I think the other prevailing zombie concept that I think it's important that we address is that somehow the tobacco issue has been addressed. You know, give yourself a shake pipe, take a deep breath. It's all changed for the better. When you graduated from medical school, at some point in the last century, 55% of Ontario males were smokers, and today the daily smoking rate in Ottawa, leafy jog along the canal, civil servant, high-tech Ottawa, is 12%, and the overall provincial rate in British Columbia is 14%, and it's down to 16 or 17% in Ontario. So yeah, a lot of good things have happened. But the patients and clients that you and I see are not representative typically of that general population. And so given that the population has also expanded, there are still millions of Canadians who are smokers, and they are disproportionately represented in all of the clinical encounters and all of the clinical settings that we occupy. And it's essential, if you're giving any kind of an academic presentation, to have a slide invoking the name of the New England Journal of Medicine, and I've got that one out of the way now. But you know, 1 year ago, the New England Journal reminded us again that smokers lose 10 years of life expectancy as a consequence of their smoking. And that if we can help people stop smoking before they reach the age of 40, we basically eliminate 90% of the excess preventable, avoidable, premature morbidity and death. Which is why I think it's important that all of us who see smokers, irrespective of our clinical environment or our clinical settings or perspective, have a responsibility to try to address this in ways that are sensitive, ways that are sophisticated, ways that are strategic. And certainly the mental health environment is no exception. And in fact, that same issue of the New England Journal, this is a very rich academic presentation, there are 2 slides from the New England Journal of Medicine, points out that those who care for smoking-related illnesses, and psychiatrists were particularly identified in this group for reasons that I think will become clear in a moment, should be doing more to stimulate quit attempts. Well, in the Coles to Newcastle category, now I'm wading even deeper into trouble because I know that you're aware of these kinds of relationships and this kind of data, that those with chronic mental illness or psychiatric conditions have a life expectancy in Canada that's 25 years less than that of other Canadians. A staggering discrepancy. And tobacco addiction is a major contributor to that premature mortality. And we know that because of the existence of psychiatric comorbidities, that rates of smoking are much higher in this population. 44% of all tobacco products in North America are said to be consumed by individuals with psychiatric comorbidities. And as one of my colleagues rather ironically pointed out at some point, it may even have been Peter Selby, the tobacco industry is the only organization, entity, or grouping in society that has not actively discriminated against the mentally ill. And indeed, there is good evidence to suggest that the tobacco industry at certain points specifically targeted it as marketing for certain of its products to those with psychiatric illnesses. And there is absolutely no question that the tobacco industry knew more about the neurophysiology of nicotine addiction and related topics, and kept it buried because it never published it in the scientific literature for decades. And some have suggested that they retarded the whole development of neurophysiology in those areas as a consequence of the secrecy with which they acquired this particular knowledge. From time to time, people talk about the population of smokers today being a population of hardened smokers. And we can have elegant debates about whether or not that's a real phenomenon, but I think it is the case that certainly in my setting, and I would suggest in yours, that those of the patients or clients that we see who are smokers are very different than the smokers that we saw 20 years ago. And by and large, the transformation of the social and public environment, the proscription of tobacco advertising sponsorship, et cetera, all have had a very profound impact upon smoking rates in the community. And those for whom cessation is more difficult, therefore remain smokers.